Welcome to the Isidore Cone Jr. MD Student Learning Center, a 14,000 square foot state-of-the-art teaching environment located at 2020 Gravia Street in the heart of the medical campus. Named in honor of the legendary educator and chairman of surgery at LSU, and opened in August 2001, the center is an educational showplace. No school of medicine has anything today that is better. The center is a tribute to the foresight of the dean and faculty of the School of Medicine, the leadership of the Medical Alumni Association, and the generosity of alumni and friends of LSU School of Medicine. Done under the auspices of the Institute of Professional Education, the alter ego of the Medical Alumni Association, the Learning Center was constructed entirely with private gifts in record time and then donated to the LSU system in November 2001. The long list of major donors is prominently displayed in the center. The James D. Reeves Surgical Society leads that list, and formal dedication took place at their annual meeting in March 2002.
I'm a sophomore medical student, and I'm working on a computer-based diagnostic reasoning case where we're presented with a patient with a problem, and we try to work through to get to the diagnosis. And it's really about the process of asking the right questions and doing the right exams to get to the correct diagnosis rather than just skipping ahead to the diagnosis itself.
It's a great way to learn how to ask the right questions when evaluating a patient without worrying about making the patient nervous or ourselves being in a situation where we're not comfortable.
I think DXR was good for two reasons. The first was it made us realize what, I guess, the general order of how to do things, starting with a history, then a physical, and then going to labs. And I think when you enter first year, you don't realize any of that. I didn't know how it worked. And as we, progressed to our second year, we got to learn how to do more treatment options and assessing and making plans for patients. And you kind of just carry it over into third year because that's what all, when you write notes on a patient, when you interview a patient, that's what it's all about.
The clinical forums, what they did was they gave us an opportunity to do our own research and give presentations to our peers so that it was a transition from second year to third year where we have to do presentations on the material that we learn on the wards.
We're second year medical students, and we're doing a lab on trauma. And we have a mannequin here, and the mannequin presents with certain characteristics, I guess, of trauma. And this right here today is a 14-year-old girl who has some abdominal trauma. And so we're just doing a full workup, breath sounds, blood pressure, and from the symptoms that she presents with, we're trying to do a diagnosis of what her problems are. Working on the mannequin gives us first-hand experience on working with a patient without the stress of actually working with a real person. So I think this experience will help us when we get to the wards one day. We'll be more experienced with taking blood pressures and lung sounds and such without the stress of doing it for the first time. We already feel like we have the experience in here already.
The skills classes prepared me for the wards by giving me an opportunity to practice managing patients in certain situations, especially traumatic situations. So we learned how to take blood pressures and read heart monitors and read pulse oximetry readings and learn how to read EKGs so that when we're on the wards, we would already know how to do those things and use the equipment.
In today's simulator lab session, we're given the opportunity to work in a situation given to us by our teacher. In today's situation, we're given the scenario of a police officer entering the emergency department after being involved in an explosion causing thermal burns on his chest, face, and upper respiratory tract.
Today's simulator lab was very useful for me because I was able to intubate a patient several times. And I was able to do it in conditions that are going to be similar to the emergency room. I was also able to start an IV, which I have not had any practice doing, so that was also extremely informative for me. Also, being able to insert a Foley catheter and just the idea of measuring urine output, the idea of administering pain medication and through an IV, and a lot of these things that the first and second year of medical school didn't allow for us to experience, this lab has made that possible.
This lab also, it's allowed us to think through an entire problem. We're not just looking at the basic sciences or the clinical aspect of something, but we're actually thinking through an entire scenario with changing parameters and issues that allow us to think through what's going on with this patient. Every time we give a medication, we're seeing a change in the blood pressure or the heart rate of this patient. We can give fluids, check urine output, and perform invasive procedures.
The major difference here from the skills lab is that the skill lab would focus on one aspect, and we weren't able to see everything put together. We weren't able to see the effect of a medication that we might be administering on the blood gases and on the heart rate and on the respiratory system. And this lab has enabled us to put the entire process together, such as it'll be when we're in the emergency room.
In this scenario, our patient has already been intubated, IV access has been obtained and IV fluids have been administered, a Foley catheter has been obtained, and Jeff now is going to begin to administer morphine for pain control. The unique thing about our mannequin is that every syringe has a barcode that is read by the computer so that the computer knows which medication we are administering. There are also sensors within the mannequin that measure exactly how much medication has been administered, which will then affect our patient's respiratory status and his vital signs.
As a third-year medical school student, I would like to say thank you for the simulator and for the knowledge base that it's provided. It's been a wonderful opportunity to work in a small group with 2 or 3 fellow students and an instructor and be able to apply our clinical skills with our basic science skills that we've been provided. This is an opportunity that a lot of other medical school students don't have, and I would like to say thank you for providing this to us.
The center, a vibrant part of the medical campus, is both a tribute to a man and a shining example of progress in medical education at LSU School of Medicine.